Eligibility for the COVID-19 vaccine has expanded to children, yet families continue to have questions about how best to keep their children safe and healthy. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederley with AHA Communications. In this new podcast series, Joining Hands to Build Pediatric COVID-19 Vaccine Confidence, we're speaking with leaders from 3 national organizations to discuss how to address vaccine hesitancy, specifically in historically marginalized communities. AHA's Julia Resnick, Director of Strategic Initiatives, moderates today's podcast. She's joined by Lydia Isaac, Vice President for Health Equity and Policy at the National Urban League. They'll be discussing the importance of clear communication and outreach to build vaccine confidence in the Black community. This podcast was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. And now, over to Julia.
Well, Lydia, thanks so much for joining me for this conversation. Let's jump right in. I want to start with talking about the National Urban League's recent report on tracking equitable distribution of the vaccine to Black communities. Can you share what you're learning and what you're seeing related to COVID-19 in your community?
Yeah, thanks, Julia. I appreciate it. We've been doing a lot of work on trying to educate and have outreach to our community about the importance of vaccines. And our real position is about helping people make the right informed decision for them and their families. And our messaging has gone in, we're trying to be all in. That is our campaign, All In Against COVID, and all in protecting our families and ourselves, and particularly our communities. And so what we have really been trying is really being the resource for folks on questions. What we've been really seeing, particularly now with the Delta variant and the big push to vaccines, is people just having questions about the vaccine and not really understanding the science behind it, feeling like they're being forced to do things and rushed, and not understanding why there's this big push to get communities like our, communities of color, vulnerable communities vaccinated. And so our affiliates, just to say a little bit about the National Urban League, we're a national organization that has 91 affiliates in 36 states. Our affiliates have been doing a lot of education work and outreach. We have a CDC grant to do that work in the community on the ground. So really, it's just been about trying to answer people's questions and help people make informed decisions. Of course, to be honest, we would like, our stance is that the vaccine is good, but we're not going to force or push people or tell them they have to do something. We're saying, hey, this is what we know. This is how we know it. This is how we know it's going to be beneficial. And we hope that this can help you make the decision that's best for you and your family.
Absolutely. So what do you see as the key challenges to building confidence in the vaccine in the Black community?
Honestly, it's mistrust. It's distrust, mistrust. Historically, African-American, immigrant, Latino, Native populations have had a mistrust of the medical system because they have not been treated well. And, you'll hear a lot of people say, well, why do they want us to take this now? They don't care about us before. Now all of a sudden they care about us. And so there's a huge mistrust of the system and not trusting. I won't say it's not trusting science, but I don't think it's not trusting science. I think it's not trusting who the science is coming from, right? I think that's because what we've been seeing is that when you have, doctors, Black doctors, or people that they trust, talk to them, even family members. It's happened to me. I had to have an hour-long conversation with an uncle early on and be like, you are over 60. Like, I'm not going to send you out to get something that is going to, hurt you. I wouldn't do that. You're my family member. But I literally sat down with him for an hour and went through every single of his points. And that's finally what convinced him, because he trusted me, right? It wasn't that he was scared of the science. He didn't trust who the science was coming from. The other thing is just we have huge disinformation campaigns on social media. I make the joke, I was like, WhatsApp is killing our communities, particularly immigrant communities, Latino, African, Caribbean communities that are getting a lot of disinformation through WhatsApp channels. People are forwarding things. And it's amazing when you hear, I saw this on WhatsApp, and you're just like, why are you getting your information on WhatsApp? Or Facebook, honestly, and this is not against all those platforms. This is just that that's where people are using to target our communities with disinformation that is, for some reason, as we know, it is preying on their already their fears, and so they're like, well, I saw this fact somewhere, and I'm like, but that's not the truth. So that's the real big thing, is that we're seeing already a deep mistrust of the system is being sold by a disinformation campaign that's particularly targeting communities of color and immigrant communities.
And it's so hard in a situation where like the pandemic is constantly evolving and our knowledge changes by the day.
Right. And I think, this is a good point, Julia. I'm happy that you asked that, because I've been frustrated a lot sometimes with how we're reporting this. And honestly, my own public health professionals about like, this is novel. This is a novel coronavirus. We have never seen it before. We have to learn how to be more nuanced in our language and not so absolute. Because what I hear a lot of people saying is, well, in the beginning, you told me X, and now you're telling me Y. And also, because we as people don't really do well with nuance, just in general. I'm talking about humans in general don't do well with nuance, but we don't help ourselves when we became so stringent in the beginning and now have looked like we changed our minds, when really we've gotten new information that has helped us to make new decisions, but we don't explain it that way. We just say, now you all do this, right? And I think that's really hard for people because, I've been hearing radio, television, other stuff where people are like, well, you told us this a year ago. And I'm like screaming at the screen. I'm like, this was a year ago. We have so much more information, and we've changed our guidance based on the information we've received, but we haven't messaged it that way. And so I think that is a huge factor also, that because this is so novel, like look at what's happening with Omicron. It's like every day we're getting something, we don't know what's happening. And we have to message this correctly, that this is new, we're learning. And as we learn, we're making better decisions with the more information we get. But the decisions we made were based on what the information we had at that time. And as we get more information, then the decisions change. But that's really hard to message on a large scale. And I think that is fundamentally some of the largest problems that's happening right now with, even with the vaccines where, breakthrough infections. People are like, well, if there's breakthrough infections, why am I getting the vaccine? Well, because you won't die and you won't end up in the hospital. But we haven't messaged that well either, because we gave people the impression that the vaccine was going to be the solution to everything and that it was going to cure it, which it can't, which it was never intended to do. And then everything will be okay. And that's just not the truth. And so our messaging has to be better, but particularly in communities where they already have mistrust and a disinformation campaign is being directed at them, that makes it even harder. But it is novel. Like, we have to understand that it's novel, it's new, we've never seen it, and we are literally building the plane as it goes, and that's okay, but we just have to be truthful with people that that's what's happening.
Yeah, and I think that really just brings to light how important communication is during all of this, and respecting the nuances and the changes, and that we're really all in it together trying to keep each other safe. So we've talked about vaccines a little bit, but I want to focus on the pediatric population because, as we all know, eligibility for vaccines is now expanded to kids age 5 and up. So how has vaccinating kids been going in your community, and what are you seeing, and what is NUL doing to foster confidence for kids?
We have not as much, because it's just been approved. We have not as much focus on kids. We've been really focusing on adults. But what we're trying to do, or we're hoping to do, is really focus on the parents and say, okay, are you vaccinated? Did you get vaccinated? If not, why not? Are you going to vaccinate your kids? Why not? And have those conversations, because I do think, I've been hearing in the broader community, parents who are vaccinated who are just like, I'm not giving my kid that, and I'm not understanding the nuance. And well, I'm not going to understand. I understand the nuance. I think it's very interesting. And part of it is they're just like, well, I've heard radio, other places, people say, well, I'm not so worried if there's side effects for me, but like, I don't know what the side effects would be for my kid. And I can't put my kid, they're still developing. We don't know this stuff. And I think that's just so interesting, that argument, because we give kids vaccines all the time. And they're like, well, it hasn't been around long enough. And it's like, well, no vaccine is in the beginning has ever been around long enough, we have told. But what we have seen, which I think is a message that's not getting out as much, is that from all the vaccine we give kids from beginning to now, the side effects are seen within the first 7 to 12 weeks. We now know that there are kids who have been taking this thing for 6 months. My nephew, who's 13, got it in May, I want to say, or June. My niece is 9. My sister happens to be a physician. The minute it was approved, she got her the vaccine. She just got her second dose, I think, last week, right? And so I think, we also, it's about the education, the outreach about like vaccines in general do not have long-term effects. They're not changing your DNA, explaining to parents that their kids will be okay, that they've tested it. They tested it on hundreds, well, not hundreds, but thousands, tens of thousands of kids with no adverse effects. There's also thing we also have to give parents credit also too, because I think it's something we have to address, that though kids are getting it, they're not getting it as much and they're not getting as sick, right? And so I think there's a lot of parents who are just like, I'm going to take my chances. And I think what people don't realize is, yes, they're not getting it as much, they're not getting as sick, but they can pass it on. And that's the biggest risk that we're seeing, and I think that's an important risk. But I also understand the trade-off that parents are trying to make with that, saying, well, if they just wear masks, they don't get as sick. I'm not sure about the vaccine. There's all these questions that you have to help people work through. And I think that's the important part. It really is like on the ground education and talking and understanding. And still, a parent has to make an informed decision for themselves, unless it gets mandated by schools, which at this point we see that's not going to happen just because of the politics of it. 10 years ago, yes. Now, probably not. So, yeah.
We live in a world where we're all just weighing that cost benefit analysis of all of our actions. So
it's true. Yeah.
As long as we're making it clear that the benefits of the vaccine are so much greater.
And I think something like Omicron actually increases that, right? It's supposedly, from what we can see from 2 weeks, we don't even have enough. It's milder, but more contagious. So do you want to have a bunch of kids who have Omicron, but they're sick, like they have like flu-like symptoms for several weeks? I mean, I don't know I personally, as I'm not a parent, but if I was a parent, I wouldn't want that. Also, because we also don't know the long-term effects of COVID. We see people who are long COVID, who are long haulers, and they're having serious side effects. And I just would not. On the other hand, my argument to parents would be, I would not want to put my kid through that. Let them get it, because you are seeing kids with long COVID also. And, you are also limiting their opportunities when you have a respiratory disease that is going to cause them to be tired all the time or have breathing problems or all that kind of stuff. So, those are the weights they have to mess. But it's a hard decision. I get it. It's a hard decision for parents. And I don't envy them. Me personally, I would say the benefits of getting the vaccine outweigh the risk. And the benefits of your child not getting COVID outweigh any possible risk you may think the vaccine has. And we don't know of any right now.
Right.
Yeah.
So one closing question for you, just to wrap this up. What is one thing that you think the healthcare system could do that would help increase confidence in or access to the COVID vaccine in the Black community?
Wow, Julia, people always ask me this question, and it's such a hard one because it's not one thing, right? It is really a fundamental change in how we treat patients, and particularly Black community, to patients in the Black community, and how they get access to care and how they're treated in the healthcare system. And so, I could say, yes, let's have more cultural competency, but what does that mean? That means a fundamental change in the system. So if you're going to ask me to be broad-based and be pie in the sky, it would be to fundamentally change the system and how we do healthcare in this country, right? And so, that's not an easy ask, right? That is, systemic societal change, but that's what's going to happen. You can't just erase decades, even centuries of mistreatment with one action, but you can start with a bunch of small actions, right? You can start by, understanding the patient's autonomy and understanding that we need to learn how we talk to patients, how we communicate more effectively, how we support patients and respect a patient's choice. And I think that's really important because a lot of times the healthcare system feels really condescending toward African American communities, that we don't know what we're talking, and paternalistic, and they are just non-compliant. And you hear all these things, and nobody talks about the context surrounding why these happen. So I think some real soul searching on the healthcare system side of thinking about how are they coming off to patients that cause maltreatment and misinformation and mistrust. And so I think that's really important. It's hard, I always say this. People are just like, oh, you always mention, but I have a sister who's a physician, and she's 15 minutes, and I get it. It's not she's a primary care physician, and I get it. They have a short amount of time. Our system has not also been created to help them spend that time, and when she spends that time with the patients, which she does, then she's backed up for the whole day and doesn't eat lunch. You know what I mean? Like things like that. That's also not fair to the providers. So we really have to think about our system.
Absolutely. Well, Lydia, thank you so much for talking to me about this. It has been an absolute pleasure. Best of luck with everything.
Thank you, Julia. Have a great day.
You too.